Before the introduction of the Sunderland Care Home tablet, visit requests to GP practices about care home residents were based mainly on a feeling from the staff that they may be a little bit more poorly than normal. Nowadays, when we receive a visit request, it's backed up with some really good objective information based on their current levels of observation, where care home staff can see either a deterioration or an improvement in their symptoms. The visit urgency can be guided by the observations that we're receiving. We can code this information and put it into our GP systems. We're going to be doing some training with our reception staff so that they're aware of what that information means as it comes through, but it's a fantastic way of showing whether somebody is improving or deteriorating and how quickly we need to get the right person out to see that care home resident.
As a manager, the tablet's been a huge success. It's increased all of our confidence, and we now have the ability to talk to other medical professionals with more confidence about its use. It's allowing us to identify and give fact to people when we ring up, rather than just a feeling, I don't feel like someone's well. It's allowed us to actually say, I have a baseline read and this person's now saying they're not feeling very well and I've got a change in their observations, which is something we've never had the ability to do before. So when I think you might be unwell and I bring that box with all the equipment in, can you remember what I do?
You take my blood pressure.
Yes.
And my temperature.
That's right.
And everything.
And then we've got that little probe we put on your finger.
Yeah, that's right.
And that's for your oxygen levels.
Yeah.
Yes. Yeah. And so that would allow me to check to make sure that you were well, or if it showed that you were changing and your blood pressure was different or your oxygen levels were different, I would be able to then get help.
Yes.
And I'd be able to ring with some information to hopefully get the right people to come and help you and get the right treatment.
Yes.
I've been involved in working in elderly care for the past 20 years, and most recently involved in the care home project, and the digital tablets came on the back of that project. We were asked to go into the care homes and do assessments, geriatric assessments on all of the patients. Whilst we were in the care homes, we felt that the carers and the nursing staff lacked the skills and knowledge to be able to do clinical observations, and also to be able to prioritise from them clinical observations. So I was involved in the tablet to initiate the clinical training with the carers around basic observation and also the news score. This enabled the staff to gain confidence and competence to deal with problems within the care home setting, and also to triage patients and signpost them to the most appropriate clinician to deal with that problem.
We first had some training on this equipment, and I think we were all quite nervous that it would be difficult to use, but we found it really easy, and to be honest, it's been really helpful for us to speak to other professional people, because us as a residential care home, we don't have like observations and temperatures behind us. So I feel like being able to take somebody's oxygen levels sort of gives us information and empowers us to be able to speak to other professionals and have something concrete that they can work with, rather than saying, I don't think so-and-so looks very well today. Also the fact that we can work out the news score, which is used in the hospitals and by other nurses and other professionals, that gives us something concrete as well, an actual figure that they can recognise if it's high or if it's low. And how easy it is to use, all of our senior team are finding it really good and easy and building up the confidence with it. So it's been positive, a definite positive.